Body Logic Physiotherapy, empowering people to achieve better health.
I think this myth is a very strong myth, and it's very undermining of someone's ability to pursue their recovery to full health. You can imagine that if the sense that your body is fragile and vulnerable, and as you continue to do activity, you're more likely to damage yourself more and have more pain in the future, it becomes a bit of a lost battle.
Welcome back to episode 18 of the Empowered Beyond Pain podcast, proudly brought to you by Body Logic Physiotherapy. In this episode, I welcome back Dr JP Caneiro. JP is a specialist physiotherapist and has a PhD in musculoskeletal physiotherapy, where his main topic was investigating high pain-related fear in people with low back pain. This episode is kind of at the core, and that's a pun intended after our last episode, but it's at the core of our question: is there more to pain than damage? I think you'll find that there's so much to relate to in this episode that will hopefully help you understand more about pain and help empower you on the road to growth. Thanks again for your valued attention. If this podcast resonates with you and is helping, please consider sharing it with someone else who it may help. Maybe someone with pain or someone that treats people with pain. Reach out via EBP Podcast on the socials and let us know what you want us to discuss, and check out the show notes for this episode at www.bodylogic.physio/podcast. There you'll find links to relevant and helpful resources, as well as references and a transcript. So wherever you're listening or watching this on YouTube, we're so grateful that we get to bring evidence to your eardrums and help make sense of science for you each fortnight. We'll start today's episode by hearing Fact 8 from the 10 Facts About Back Pain paper, presented by Patient Voice and guest on episode 14 and 16B, Joe. And remember to ask, is there more to pain than damage?
Backs do not wear out with everyday loading and bending.
The same way lifting weights makes muscles stronger, moving and loading make the back stronger and healthier. So activities like running, twisting, bending and lifting are safe if you start gradually and practice regularly. Welcome back to the podcast, everyone. We're welcoming back JP. JP hasn't appeared on the podcast for a while, so huge welcome back to you, mate. Today we're discussing episode 18. We're discussing Fact 8 from the Back Facts paper. The fact is that backs don't wear out with everyday loading and bending. This comes about from the myth of that repeated spinal loading results in wear and tear and tissue damage. And I'm looking forward to discussing where the facts come and the evidence behind that fact. I guess it's a pretty common belief that we see in people with pain, and I'm talking probably specifically about back pain, but it actually applies to knee pain, neck pain, and most pain really. And that belief is that the pain is because of wear and tear of their structure, and that they should stop moving and loading that specific structure because it will wear out even more, and eventually they'll end up, crippled, old, disabled in a wheelchair. And if they're this bad and in this much pain now, they're often worried about what they're going to be like in 5, 10, 15, 50 years' time. So I guess what are some of the some other examples or stories people come and see us with, some common beliefs around this narrative?
Yeah, thanks, Kev. I think this myth is a very strong myth, and it's very undermining of someone's ability to pursue their recovery to full health. You can imagine that if the sense that your body is fragile and vulnerable, and as you continue to do activity, you're more likely to damage yourself more and have more pain in the future, it becomes a bit of a lost battle, because we are all aging with time, and if we are creating this wear and tear now, and what happens if I play more soccer? What happens if I continue on going on my bushwalks? And that becomes really undermining of people's confidence in their body. And fortunately, the evidence doesn't support that myth. There's mounting or growing evidence that supports several other factors that influence someone's pain experience, and smaller amount of or little evidence to support that only damage is responsible for someone's pain experience. So some of the examples that we see are patients that come up with a history of back pain or with presenting with back pain, that their world has reduced because of daily activities they used to do habitually without thinking, now became sensitized. And every day they need to think about the tasks that they're doing, and they're thinking about how they posture themselves, if they should do it or not, how they should pick up a shoe from the ground, how they should empty the dishwasher. And behind this concern about that task is this belief that if they do such task that is painful, it means that they're causing more damage to their body. And that this is an inherent vulnerability that we carry in our society, or a perception that we carry in our society, because it's a really strong belief that pain equals damage. If we think back in the day, you develop pain, you go to see the doctor sends you for a scan. That's the first time you're getting a scan in any body part, and that body part will very likely demonstrate some age-related changes. And so in the past, we used to be very quick at associating those changes in the scan with the pain experience that you have. And unfortunately, this continues to occur these days. But if we look at the evidence, we are not standing on a very strong ground to make that relationship. And oftentimes we see patients that go on to have a scan, and they have a good looking scan, a very healthy looking spine on an image, which doesn't match with the pain experience they have. I saw a gentleman last week who has a very distressful pain experience over the last 7 months. And this guy is really struggling. And the only finding he's got on his MRI is a minor disc bulge at L4-5. And he's a 42-year-old man with a long history of playing sports. And so you look at the relationship of his pain experience, he's completely disabled. He can't sit for more than 5 minutes. He can't stand for more than 10 minutes. He stopped walking. He struggles to make his kids breakfast in the morning. He'll do a Vegemite sandwich, and then he'll have to lie down on the couch for 10 minutes, and then he'll stand up again to try and complete the other sandwich. And there he goes. So it's a very distressing pain experience that led to significant disability. But when you look at the scan for any male 42-year-old that has a scan of their back, it's very unlikely that you won't present a minor disc bulge. And as a matter of fact, on examination, when you load that segment, he was sensitized, but palpating his spine, he wasn't sensitized. Palpating the muscles around the spine, he was very sensitized. So he was sore to touch on the muscles, but not sore to touch on the spine. But despite that, he was bracing and guarding his back, because his belief was that in every action that he was taking and every task that he was performing that was painful, that meant that he was further creating damage to his spine. And exactly like you said, I played football all my life. I'm only 42 years old. I want to continue doing physical activity with my kids. But what is it going to be in the future if I'm at that state? I only have this small change in my back and my life is ruined. What happens if, as I get older, I have more changes in my skin? So it kind of it leads people in this path that is really hard to shift from. And the tricky thing with pain is that it's a felt experience in your body. So those warning signs, they alert you in every movement that you're doing on a daily basis. So this guy, he wakes up and he feels pain in his back. Immediately, his body goes into a protective response. And that protection carries on. So initially, he developed some pain in a context that was very stressful time in his life. And he first felt his pain sitting in his office. So sitting was the first task to become painful. But very quickly, he started avoiding bending. He changed the way he picked up his kids. He changed the way that he would sit in the car. He changed the way that he was going for walks. Now he avoids walking, swimming, picking up his kids. So you can see this generalization of avoidance, which are entirely based on warning signs that he gets from his body. So he feels discomfort, he feels pain, therefore he shouldn't do it. So his world has reduced. And initially he was sitting, and now he's afraid of twisting. He's afraid of lifting his arms above his head because that bends his back backwards. He's on Google looking at what happens with the disc when you do all these movements. And let me tell you, the information that you find is not very supportive of movement on the internet, unfortunately. So this belief can have a significant impact. And this is a patient who I asked. I said, what do you think happens the more you use your back? Well, I have more pain. And what do you think it means? Well, it means that I'm causing more damage. And I've been told by other professionals that usually if one disc is gone, I will tend to wear out the disc above or the disc below. And, so it just kind of, it goes on an avalanche of disability.
Snowballs. Yeah,
snowballs. And the interesting thing with him was that he had an epidural to supposedly the source of his pain. And he had a day or two of pain reduction. And that was it. It wasn't even a significant change. And that baffled him because he's going, you put this corticosteroid injection in my back right at the source of the pain. Why am I not better? Why, if that's the source of the pain? So you can see the same person that strongly believes that the disc is the source of his pain and that the more that he does creates more wearing and tearing, is confused by the fact that he had an intervention on the source of the pain, and he had close to zero effect. So this guy is pretty distraught in that situation. And to change someone's, to shift away from that idea that you should protect your body, that you should guard your body, towards an idea that actually movement is healthy for your body, it can be a really tricky transition.
Yeah, absolutely. And you can kind of see that that's quite if that's his belief, if his belief that every time he feels pain, he's making his condition worse, he's making his disc bulge worse, then it's quite a common sense response to start avoiding those things if that's the meaning that you attribute to what the pain actually means. And I think you sort of, I guess it kind of comes down to one of the key messages that we talk about in this podcast around questioning, is there more to pain than tissue damage? And that uncoupling of that relationship between pain not necessarily being a direct relationship or a direct reflection of what's going on at a tissue level. And I was hoping we could kind of talk about some more examples around how pain and tissue damage aren't that well related. But before we do that, I just wanted to sort of clarify this person's, this case that you're talking about. So is it fair to say that his pain that he was feeling perhaps wasn't coming from his disc, and maybe it was coming more from his muscles by the sound of it, potentially clenching all the time? And that's probably quite a reductionist approach, or a very simple way to look at pain. And we know that pain is a lot more complex than that. But I was wondering if you could kind of talk to what was causing his pain, or what is causing his pain.
So it's really hard to say, but I have no question that his back structures were sensitized, and that would be his disc, his ligaments, his joints, because the way that he was protecting his body was by bracing his body. This is a guy that's sitting across from me, and his breathing was really shallow. He was bracing his belly while sitting in a chair. So the amount of load that he was putting in his back was quite significant for a task like you and I are doing right now, which is just sitting, and we are supported by our bodies, the chair, and our bellies are not tensing up. So what exact structure was sensitized, I'm not sure. And perhaps the L4-5 minor disc bulge could be sensitized. And it makes sense. If you have a sore wrist and you're squishing that wrist all the time, if both of us continue this conversation for the next 40 minutes doing this, it's very likely that wrist will be a bit uncomfortable. And if we repeat that tomorrow and the day after tomorrow, and I go and I brush my teeth like this, and I start doing other tasks like this, it's very likely that my wrist will be sensitized. And so in my understanding of his presentation, the behavior that he was adopting right now, 7 months down the track, wasn't very helpful. But that was identified through an examination where he was given an option of offloading his back and learning how to relax his back and sitting in a more relaxed manner. And then you were sitting for nearly 10 minutes without feeling any more discomfort. And that was an experience, a felt experience, that he wasn't getting the same warning signs that he usually does. And that was a way into his belief system to challenge that, where he's going, look, I feel like I should be protecting, but actually when I'm not protecting as much, it feels better. How is that possible? And that's what it's the job that the clinician has, to challenge that. So you look at the mechanism. He started feeling pain when he was sitting in his office. He sat on that office for a number of years. But what was the context of that? And there were significant personal stresses in his life that led to changes in his sleep, led to changes in his physical activity, led to changes in the amount of hours that he was working, and that he was more sedentary. And then his back became sensitized. I'm not saying that they were the causes of that, but that's the context in which his back became sensitive. And soon after that, several other activities in his daily life became demonized because of that discomfort.
Yeah, because he felt the pain, right?
Yeah, so I think it's really important for people to understand that daily tasks such as bending to tie your shoes or to pick something from the floor, lifting your child, or picking up the garbage, or turning back to put your seatbelt, or to speak to your son on the back seat of the car, things that we do on a daily basis, they often are provocative in people that have back pain. Or I should say that people come in to see us often report those activities as being painful. So what does that mean? Does that mean that those activities cause pain? No, it doesn't mean that. It means that your back is sore. And when you do those activities can make your back sensitive, right? So, but you've been doing those activities for the majority of your life. But now, during this period of time, they became a bit sensitized. So what we need to do is to identify, why you're sensitized. What are the factors that we can actually change that can potentially reduce that sensitivity? And it's fair if you develop pain after doing, let's say, gardening, you develop some back pain. And then the next day, taking the bin out is a bit sore, picking up your kids is a bit sore, going for a run is a bit sore. And maybe you take it easy for a couple of days and you let your body settle, and then you get back to doing these activities again. And oftentimes we get patients that come in to see us that they gradually stop doing those everyday activities, or they continue to do it, but they do it protecting their bodies. And when you ask them, many may say that they are doing that consciously because they know that they shouldn't bend. And they might even tell you that, I have these posters at my work demonstrating how you should bend and lift and how you should sit. And I never really paid attention to that. It's something that you look every day, but you don't pay attention. But now I'm really mindful of it. And from now on, I'm going to take care of my body. And how is that going for you? Well, It's not better yet, but that's what I should be doing. Right? So people can change their behavior based on the symptoms that they have, despite the fact that the new behavior doesn't really change their pain experience. And I guess what we need to understand is that moving your body can help to reduce sensitivity in your body, and it can create more health in your body. So let's get an example of osteoarthritis, or commonly perceived as knee wear and tear. Right? So your cartilage had enough, and you ran too much, or you played footy too much, and that's the reason why your cartilage doesn't look very good today. That's a very common belief. And the cartilage itself, if you rest the knee, if you immobilize the knee, if you protect the knee, what we see is that the health of the cartilage reduces. The cartilage becomes drier, becomes less able to produce movement with ease. On the other hand, if you get a sore joint and you gradually promote movement in that joint in a way that is not highly provocative, and you do it regularly and consistently, what we see is that cartilage actually looks healthier and responds in a healthier manner. What does that mean? It means that it's not as stiff. It moves better. It's less provocative. But to be able to start moving a painful knee joint, you have to go past the barrier that the more movement you do with that knee joint will create more wear and tear. Yeah, and that's why this belief is so undermining. And if we look at from a clinician perspective, right? You look at the work the shift in management of tendon pain, tendinopathies, right? In the past, used to be, protect the tendon, rest the tendon, avoid physical activity. And over time, that changed significantly. And today, a large proportion of clinicians, and perhaps even the public, will start thinking that you actually need to exercise the tendon, because the tendon gets healthier and becomes stronger with movement and load that is provided gradually. Correct?
Yeah. And with adequate rest as well, right?
Yeah, exactly. So it's like the capacity demand balance, the seesaw that we see, that we have. So if the demands are high and the capacity of the tendon is low, you gradually build that up. So what does that tell us? It tells us that a tendon, if stimulated in a consistent, gradual manner, can become healthier, right? And we look, and if we go into it, we can see tendons that have significant changes on an ultrasound or an MRI that can become able to tolerate and produce load, such as running, jumping, playing basketball, volleyball, and etc. So there and then we have an example of a structure that on a scan could be labeled as damaged, but it doesn't reflect the capacity of the person. The person is back doing their activities. And what that created for clinicians like ourselves, it gives us confidence to get patients to gradually load their tendons, right? Where if you have pain that is acceptable, that is tolerable, and it doesn't influence too much your daily activities, you continue stimulating the tendon with that load, right? Now, when we move to osteoarthritis, we are kind of playing catch up now. And we see some really good work that is coming out to demonstrate that the same principle applies. If you get someone that has significant changes on a tibiofemoral joint, and they have pain with doing activities such as getting up from a chair or bending down to pick something on the floor, and they can barely use their leg, but you gradually build the tolerance to load on that knee joint, and you do it not completely pain-free, you actually accept that having some discomfort is part of the process. And for patients, that's a really tough idea to grapple with. But the ones that experience that, it's a winner, because you start realizing that, well, actually I can do a little bit more and my pain doesn't change. And as they keep going, there's some data to demonstrate of patients that were on a wait list to get a knee replacement and that embarked on a knee rehabilitation program to exercise their knees, and that for 6 weeks. And for the first 3 or 4 weeks, their pain either didn't change or increased a little. And after that, the pain reduced. And 80% of patients in that group decided against having surgery for 1 and then 2 years after the program, right? So what does that tell us? They aged over those 2 years. Their joint probably looks a bit different, in a more negative way, but their capacity to tolerate their daily activities and the things that they want to do has increased, and it's not sensitized.
Yeah, maybe their pain's decreased as well.
Exactly. Now, what we're seeing now, we're seeing clinicians feeling more confident to tell their patients that the scan at times is a big part of the puzzle, but at times is not a big part of the puzzle. But in both situations, we have to reduce the sensitivity of the joint. And for those who are not clinicians listening to us, what we mean by that is to make the joint a little less sore, make reduce how much discomfort is caused in a body part when you use it. And so we have clinicians telling patients that it's okay to feel a bit of discomfort, and that's part of the process. Now, when it comes to back pain, which is probably one of or the most researched body part or pain experience that there is in musculoskeletal health, we don't see as many clinicians confident to tell their patients to continue to bend despite their discomfort. We often see, and we've all been guilty of that, of telling someone to bend forward and they experience some discomfort, and you say, well, okay, so let's just back off a little bit. So then the message that we are implying in that examination is that if I feel pain with the movement, I shouldn't do it, right? And that goes directly in line with the belief that if I use my body and it's painful, something wrong is happening. And that may not be conscious on the clinician part and on the patient part, but it taps into societal beliefs. If you ask any JP on the street about what do they think about pain and damage, and what do they think about using their back when it's sore, and what do they think about bending and twisting and lifting and twisting, they are dangerous activities for our backs. And so if I have pain with bending and twisting, therefore I'm in a danger zone, right? And it's my beliefs are aligned with my experience. Therefore, I shouldn't do it. And perhaps the way I was doing before put me at risk to that. And that's been an assumption that's been pushed in research and in society. But luckily, we know today that there isn't a lot of evidence to back that up. There is growing evidence to demonstrate that actually the task that you do, while it can be provocative, it can make you feel sore when you do it, it's rarely the sole cause of the problem. And actually becoming more able to do that very task, but doing that in a graduated manner, it's the way out of or the way to recovery, and to be able to go back to doing your daily activities with less pain or with no pain. Yeah. So I guess this myth is a really important myth to be argued against, because it can really undermine someone's capacity to move forward with their lives. So I saw someone yesterday who had a terrible car accident. A young person with a significant car accident that happened just over a year ago. And you look at the scans, and the scans are not bad at all. And so at the most, she had, this person's neck became really sensitized from that accident. And as a consequence, there's a behavior, a defense mechanism that is embodied. So it's like this embodiment of cautious and protective movement, in which if I'm going to turn my neck, if I'm going to turn my body, it should be in a protective way, because something happened to my body that hasn't healed properly yet. And we know that, majority of body parts, they would heal after 4 weeks or 6 weeks. A broken bone would heal after 4 weeks. But it can continue to be sensitized despite the initial problem that you had. Now, you look at, when you dig deep into this person's understanding of their problem, that belief that as you use that body part and you get pain means that you're causing more damage. And the more they use the body part, the more pain you get. Therefore, you're causing more and more damage. So that is it's like trying to move forward with your life with a handbrake on. It doesn't work very well. And we look at the data of probably the most common signature of people with pain is that they move less, they move slower, and as they get better, their tendency is to move faster and to not be as tense and guarded. So that just, it kind of reflects this common protective mechanism that can be really useful in an acute stage. It can be really useful after a trauma. Not only useful, but necessary.
Yeah, protective.
But at some point, at some stage, we need to move away from that and rescue back our ability to do the daily activities that we've always done.
Yeah, absolutely. That was really nicely explained. And I think at the heart of that barrier is, like you said, that belief that pain must mean you're wearing out or causing further damage. And what we're saying really is what it comes down to is that this relationship between pain and damage just isn't as clear as what we used to think it was. It's not that strong. And I kind of want to talk about a few examples of that. So I'm sure everyone's had a paper cut, or everyone, you can imagine pulling the little bit of your skin next to your thumb off. And that's quite a painful experience. I've done that before, and it's, I would rate that as quite painful. But if you think about how much damage is going on in your thumb when you get a paper cut, or when you're pulling that little bit of skin off, there's not really that much damage. So that's an example where you can have high levels of pain and not really much damage whatsoever. On the flip side of that, I'm sure most people listening would have these mystery bruises that just seem to appear out of nowhere, on their legs or just on their knees or somewhere like that. And they're thinking, look, I don't know how that got there. I have no idea how I got that. I have no recollection of any trauma that has happened that's caused that internal bleeding. But so I don't feel any pain, but there's clearly been tissue damage there. So that's an example, opposite ends of the scale, where this relationship just isn't really there. And I suppose it speaks to the meaning that we put behind the pain.
Sorry.
You go.
No, I was just going on examples. Like I'll give you a personal example. As a young child, 4 and 5 years old, I was diagnosed with what is called Perthes disease. And for those that don't know what that is, it basically means it's a very early onset of degeneration of the cartilage of your hip joint. So it's almost like at a very young age, your one hip joint grows up to become a little ball, and the other one grows up to become a little mushroom. It becomes it becomes a significant change from one side to the other. And as you get older, or as you grow up, the changes become even worse. So I had some discomfort initially, but then growing up, I didn't have much pain at all in my hip. And going through my university degree, I remember taking my X-rays to clinicians, to surgeons, to doctors, to lecturers, and everyone that looked at my X-ray, they would diagnose as having hip osteoarthritis, which would fit the criteria of the scan, and that the only way out was surgery. But there I was, playing soccer, badly, by the way.
Even for a Brazilian.
Yeah, exactly. That's why I moved to Australia. They kicked me out of the country.
It's all clear now.
Yeah, exactly. But there I was doing several other activities with no pain experience whatsoever. So I've been carrying that significant change in my hip with no pain. Then at times in my life, I decided to start new activities that required a little bit more of my hip. So I needed a little bit more range. For instance, cycling, I needed to be sitting in a deeper hip flexion, or I was doing a rowing ergometer. And initially, I didn't have the mobility in my hip, and I didn't have the capacity. So my hip became sore. And as I gradually built up, because that was something that I wanted to do, so there was a demand, an activity that I wanted to do, and I gradually did that, I managed to be able to do it without having discomfort in my hip. And as time went by, times in my life where my hip became painful were times where I was more sedentary, sleeping less, and with higher levels of stress in my life. For instance, when I was doing my PhD and I had my first son. So I was not sleeping much and trying to, pull out a lot of work, working in the clinic, sitting my bum on the desk for way too long, and not exercising enough to counteract that. So that just gives us an insight into a couple of elements. One is the fact that, as you nicely described, that what your scan shows, or the wear and tear that you have, doesn't always explain pain, and that, or when it's related to pain, it doesn't explain pain by itself. And the second aspect, which is in line with a more contemporary understanding of pain, is that pain is not related uniquely to how your body looks or how your body is shaped or how you use your body, but it's related to the beliefs that we have. It's related to the social aspects of our lives. It's related to the emotions that we are going through. And for patients, it's a really tricky idea to grasp. That these factors how can being stressed and sleeping less cause pain in my body? And if we simplify it, some of the things such as not sleeping well, being sedentary, high levels of stress, and a poor diet. One of the significant outputs of those elements is an increase in an inflammatory response in your body. So there's a physiological change in the chemistry of your body, and structures can become sensitive. And sometimes some body parts are a little bit more vulnerable, either because of the activities that you do or because of the structure of your body or past experiences that you had with that particular body part. So for us to, if you look at our paper, the myth is that repetitive loading of everyday life can create more wear and tear and damage and pain to the body. That's the myth. And the fact is that actually using your body repetitively in a healthy manner and without protection is actually a better way for your body. Similar to muscles that get stronger as you use them, muscles that become less stiff as you use them and you stretch them. Other body parts are like that: the knee joints, the tendons, the discs, the shoulder, the neck. So there's more and more evidence to demonstrate that. And we need to understand that there are several other factors that can affect how one may feel. And when we talk about a biopsychosocial approach, there is, for some, there is a perception that we're talking about, that the pain is in the head, and it's the psychology, and it's always about, if I'm stressed, I'm in more pain. That's not just it. For instance, what we're talking about here today, which is beliefs. If I develop pain and I believe that using my body causes more damage and therefore pain, that will influence how I behave. If the emotions or my emotional aspect, if I under a significant amount of stress, which changes the chemistry of my body, or if I'm naturally anxious, or if I have a health anxiety, when I develop pain in my body, I will pay more attention to it. I will protect it more, and that will become more bothersome. So my emotions will affect how I carry my body and how I use it on daily life. Social aspects, such as developing pain during a time where you are dissatisfied with your job, or you're stressed at work, or you've been bullied at work, right? Or you are not participating in the social activities that you used to participate, or you're feeling socially isolated. So all these factors, they play a role around the time of pain onset, but also around persistence of pain. Some of these things may not be modifiable, but they can be used for the patient and the clinician to understand that there is more to play, or there's more to pain than tissue damage.
Yeah, absolutely. It sort of speaks to how wonderfully complex the pain system is, and some people might find that quite threatening. I sort of view it almost as the opposite, in terms of that means there's so many different things that we can do that can influence how much pain we feel, and also the meaning maybe therefore, or the downstream consequences of the meaning we put onto pain. You talked a little bit before about, how lifting weights makes your muscles stronger, and that nice example around with the knee OA as well, or knee osteoarthritis and knee pain. And I want to kind of hone in on that, because I think that's a really central message that I want people to try and understand from this episode of the podcast, and certainly fact number 8 from the Back Facts paper. We have, like we've talked about today, we have this narrative that our body is fragile, and it's vulnerable, and it's easy to break, and it's hard to heal. And that's quite a rational and quite a normal thought or belief, given the messages that exist in the world. But these are just messages. They're stories. They're maybe not that true, but they're kind of endemic and everywhere. So I think it's helpful to sort of talk a little bit about this idea that our bodies, our structures really aren't as fragile as what most people think they are. And when we think about, okay, what's the opposite of fragile? Most people would say, well, that's robust. Robust is the opposite of fragile. And robust, if you define robust, it's like a block, a rock or something that you drop, and you apply force to it and it won't break. You apply a stress to it and it won't break. But actually humans are a next step further than robust, where, there's an author called, he's written a book called Anti-Fragile, Nazim Nicholas Taleb. Speaks about humans being anti-fragile, that actually if we put the appropriate stress on our body with the appropriate recovery, then over time we add a little bit more stress and then have more recovery, and then add a little bit more stress, we actually get stronger over time. So we're not just robust in the term that we won't break when there's stress on us, but we actually adapt to stress and become stronger and more resilient and have more capacity in our structures which is, this idea of anti-fragility. And I think that's kind of the key message. And we know we have evidence that this is the case in, spines as well. We know that runners have healthier discs than non-runners. We know that cyclists have healthier disc, rowers. And when I say healthier discs, I mean, there's more water content, there's less disc space narrowing. I think it kind of starts to question this idea that the more we use our body, we wear out. In actual fact, the complete opposite is true, right?
Yeah, and I think that's a wonderful point to make, Kevin. And if we think about possibly the origin of this idea, for instance, for the back, bending is dangerous for the back, and even to a point where it's being raised the possibility that we have a set number of bends in our back. The original study that came with that was looking at human cadaver spine. So you cut just the section of the lumbar spine of the lower back, and you put in a lab, and you got a machine to bend it, right? So it's a bed structure that you will have a set number of bends, and if you bend anything enough, or if you put pressure in any structure for enough times, you get a point where it breaks down, right? And based on that, there was a jump to say that therefore human spines have a set number of bends, and human spines, if they bend too many times, they will break. And fortunately, there's been several studies done in humans that did not reproduce the same results in terms of looking at loads of the spine and etc. But what we have to remember is that our spines are not moving by themselves. Our spines are part of a whole organism that is inherently made to respond to stimulus. So if we get healthy human beings and you send them off the planet to go to Mars and come back, they feel healthy, they're acting healthy, but their bodies became weaker because they didn't have enough stimulus when they're out there. And now all these programs, they have people when they're away, they're exercising as they can there to come back as healthy as they could. If we get my healthy elbow and we put it in plaster for 4 weeks, I will have a really unhealthy elbow by the end of it. So there is really strong evidence to say that if we stop nourishing a body part, it becomes unhealthy. And nourishment for the body is movement. And it's movement that you're capable of doing, and it's movement that is done regularly, right? And so I'll give you an example of a patient. She's, how old is she? She will be 68?
Young.
Between 68, sorry?
She's young.
She's young, yeah. She's between 68 or 72. I have in my mind that she's 72, but she looks younger.
Yeah.
But anyway, and she used to practice yoga on a daily basis, and then she had a fall, and she hurt her knee, and she ended up having surgery on that knee. She had a fracture, and it was necessary to have surgery in the knee. And when she came back from it, she felt really fragile, which is natural. And the process of getting her back on her feet, just getting up from a chair and walking, it was a lengthy process. But you could see that person feeling older with time and behaving as if she was older with time. And very quickly, going from I practice yoga every day and age is just a number, towards, I feel like I'm getting to my use by date. I feel like there's not much that I can do with my body anymore. I feel like I lost all that I was doing, and now I'm going to have to do, maybe the seniors class in the gym, if I can go to a gym. So this idea that the body became really fragile and vulnerable and unable to adapt became a strong theme in her narrative in our encounters and several emails that we exchanged. And as she developed a bit more strength in the leg, And mind you, that process wasn't pain-free all the way. That process had discomfort.
Yep.
And she had to wrestle with that idea. If my leg is healed, why am I feeling pain? Well, we are kind of pushing it. Your leg is healed, but the capacity of your leg to tolerate what you need for it to do is pretty small. And every time we catch up, we are pushing it. So we are making it a little sensitive. And anyway, she bought the idea because every time she pushed it, it was a bit sore, but then she was able to push more and it wasn't as sore. So the experience is what made her continue to move forward. And we got to a point where she's doing everyday activities fine and she's back to doing her yoga practice. But something changed that she's going, I feel like I can do a bit more than what I'm doing now. And I feel like I want to feel a bit stronger. And fast tracking a few months, she's in the gym lifting weights and loving the fact that she's going under a bar and a squat rack at her age of, let's call it 70 to be in the middle. And she's putting big plates and she's lifting weights. She didn't start there. She started by just getting under the bar and with a very light bar, as a matter of fact, with a broomstick and then a bar and then some little weights. And she's feeling this vitality coming back and feeling younger again. And this narrative of, my friend invited me to go for a bushwalk. I haven't done this, but I should be able to do it. And it's almost like it's unlocking this natural human capacity. All right. It was a slow process, but I think her story is quite nice because it goes from being able to being disabled for a while and resurging again and feeling more able than she was before. So it goes to reflect what you're saying, that if you stimulate the body continues to grow. And of course, we all have our limitations, and we all have our capacities to do that is different. And our capacity may be different as well based on our experiences. I saw another lady who had hip pain, and she was really struggling to strengthen her legs by doing our traditional exercises of squats and lunges, and she was adopting some postures that she felt really unnatural with. And when I asked her about her past experience, in the past, when did you feel strong? Oh, I used to dance. I used to dance a lot, and I felt really strong in my legs. I felt really strong in my body. And I said, can you show me some of the things you used to do when you danced? And very quickly, that tapped into somewhere in her memory where she embodied that memory. And she started enacting a few of the drills and the exercise that she used to do, that she felt natural and she felt good. And very quickly, she started developing strength. So the pathway to feeling anti-fragile may not be the same for everyone. It may have similar principles, which are to do it gradually, to do it regularly, and be consistent with the belief that as you continue to do, your body can strengthen up. And of course, this is easier said than done. And I imagine there'll be people listening to this and saying, look, I tried to exercise, and every time I exercise, I was sore. Every time I did this, I was sore. And then there is the way in which you do this. There is the way in which you perform these activities. Going back to that gentleman that I mentioned at the beginning, whose life was very disabled, and we managed to, sit for a while. I asked him about some of the things that he tried, and he said, look, I was really keen to get on a bike because I have a bike, and I have a stationary bike at home. But I tried it several times, and I really struggled. And I, do you mind if we have a look at that? And he said back to me, do you mind if we don't? I said, why is that? He goes, because the thought of me sitting on a bike, it frightens me, because I'm kind of going on a good period now, and I don't want to flare out. And I asked him how fearful he was of trying the bike, and he said, I'm a 11 out of 10, because I'm dead sure that I'll be sore afterwards. Anyway, long story short, we sat on the bike, and the way that he was sitting on the bike was highly provocative. He was trying to adopt a posture that wasn't even his natural. I put a mirror next to him and I said, "Do you recognize this person on the bike?" He said, "That's not how I used to be, but that's what I have to do." And I said, "Show me how you used to be." And once he relaxed into his more natural posture.
So what was he doing? Sorry, what was he doing when he was on the bike with high fear? What did he look like?
He was trying to sit really straight and keep his back straight, and having weight on his arms, but keeping his chest up, and just really protective of his back. And
guarded and tense.
Yeah, guarded and tense. And his old natural posture was something a bit more relaxed, just kind of, as he said, I used to sit on my bum, and now I feel like I'm sitting on the edge of the seat and I'm holding myself with my back. That was his interpretation of that experience. And we sat there for 12 minutes, and at the end of it, he said, "It actually feels good. It feels good that I'm doing this." So the things that we are talking about here today, the pathway to get there, it's different for everyone. And some people, they may need some help along the way. They may need medication. They may need injections to create a window of opportunity for them to exercise because they're too sensitive. They may need psychological support, and others may even need surgery. But the important thing is that because you try to exercise and you try to use your body and it doesn't work for you, you got to probably start looking at someone that can guide you and coach you towards learning how to use your body in a perhaps in a different way, or someone that challenges your beliefs and enables you to think in a different way when you are using your body. And I think that's our greatest challenge as clinicians, to guide patients to change their mindset towards that using the body is good for the body, and that creating that regularity and doing it gradually.
Yeah. And you can see how, for that gentleman's experience of being on the bike and it actually feeling good, that straight away kind of updates his system or his understanding of, okay, well, if this feels good, I thought it was, I was 11 out of 10 out of fear, and I was almost certain that I was going to flare up, but it actually feels good. You can see how that updates his beliefs around what's happening in his body, and maybe his disc bulge isn't really as the problem that he thought it was. Yeah. And conversely, you can see how easy it is for people to get in a loop of, okay, I feel pain, and when I'm on the bike, I feel pain, so I should never do that. And I feel pain now bending as well as not just sitting, and twisting as well, so I'd never do that. And then because you never do it, your structures don't get used to it, or they're not conditioned for it. So when you try to do it or something similar, it doesn't take as much for you to flare up, and then you get more pain, and you can get down this sort of negative sort of spiral as well. And you mentioned sort of before nourishment of joints and things like that. And I think that's like highlighted nicely by an analogy of a sponge. Our cartilage is like sponges. If you leave a sponge just by itself, it can't absorb water, it can't absorb, and nourishment and get rid of waste products. But squeezing a sponge and repeatedly squeezing it and letting it go helps it absorb, all the nourishment that it needs and gets rid of all the sort of waste products. And the other thing that you sort of talked about that sort of triggered something for me was, this idea that we have a number of bends left. And, I've heard plenty of stories of patients who come and say, yeah, look, we've had a manual handling course at work and they showed us a paper clip and they just kept bending it, or gave us all a paper clip and we just kept bending it until it broke. And then they said, that's our spine. So it's no wonder that these people come, that's quite a natural response is then to be frightened of that, and I think it's really important that we squash that belief and we adapt with load, with the appropriate load. We aren't like paper clips, like I said. We don't wear out with more movement. We're the opposite. We get nourishment and get healthier and get stronger with appropriate load and appropriate recovery.
I think there's two elements as well that it's really important to bring through. One is that we are not talking about just pushing through pain. We're not talking about just doing it. We are talking about understand what contributes to your problem, and try to target all these factors. Because for some people, it's nothing to do with how they move. They move fine. They're not guarded, and they still have pain. So that's an important aspect. The second aspect is that it is also common that some people will present with changes in their scans that are relevant and associated with their pain presentation. And so it's at no point we are ignoring the biology. But even then, what we know is that if you have changes in your scan and they are a result of either a traumatic incident, or they appear gradually and they have like a sensitized nerve tissue, or you have back and leg pain, that even then movement is helpful and healing for those structures. It's just a matter of the dose in which you're going to give that. So the dose of the movement. So movement it's never out of the question. And also the understanding of all the factors that can create that. So we know from research to date that something like leg pain or when your nerve is irritated, a lot of times that is related to like an inflammatory change in your body rather than something that was damaged and is now pushing on the nerve, especially if that pain occurred gradually without a specific incident. In the past, we used to always think that it's related to something pushing on the nerve. And of course, your clinician will examine you and determine if that's the case or not. But if there's nothing pushing on the nerve, but your nerve is sensitized, then we look at other factors that could be creating an inflammatory context, such as your sleep, your mood, if you're resting too much, or if you're doing too much, or if you have high levels of stress. So we look at all those factors and going, well, these are some of the strategies that we can work on to create an anti-inflammatory environment or context, and movement will be a part of it. And then you gradually build up as the nerve comes down. So that's just to exemplify that at times, yes, the body has changed or the body is damaged. And in those cases, we'll continue to do a gradual return to activities. But when we fear and become overprotective of our bodies, that can become highly unhelpful.
Yeah. Thanks for clarifying that. That was it's really important, and highlights that it's sometimes these things are related. Things like pathology is certainly an important thing to consider as part of a big picture, a sort of a whole person understanding of someone's condition. The podcast is called Empowered Beyond Pain for a reason. We're hoping that through these podcasts we can give people understanding and update people's knowledge around the modern research and our experiences, both being researchers and clinicians. And hopefully people, I think the key message here from this episode here is that, that relationship between pain and damage isn't that strong as what we thought it was. And that, your body doesn't wear out with more movement. Do you have any final kind of comments to speak to this fact?
No, I think it's to add to the sentence you just said. I think the body craves movement, and the body gives signs when it's not moving enough and when it's not stimulated enough. And the other element as well that I think it's important to highlight is that we talked about some patients' journeys, right? And for some, that new experience, that positive, safe experience can happen quite quickly. And for others, it takes more time. And so the journey is different to everyone. And it's not, we're not here saying that it should be easy. For some, it's easier. For others, it's really difficult. And it's important as well to understand that probably, the clinician's job is to coach the person So they develop new habits and new strategies that they can self-manage their conditions by themselves. And occasions in which your pain flares up, a lot of these beliefs, they tend to come back. And some of the protective behaviors tend to come back. And these are times where it's really important to reconnect with your clinician and to review what's happening and to make sense of that flare-up. And that kind of, it's a nice segue for our next myth, which talks about pain flare-ups.
Beautifully done, JP. I was going to say the exact same thing. Next week's episode is all about pain flare-ups, and look, everyone's journey is individual, and that's why it is so important to get an individualized assessment for whatever health XYZ health condition that you've got. Awesome. Thanks so much for your time, JP. It's lovely to have you back on, and we look forward to chatting to you again soon.
Fantastic. Thanks, Kevin.
So there you have it, the end of another episode. Thanks again for tuning in. My take home, the inaccurate belief that painful movement, loading and bending causes wear and tear is a really imprisoning or limiting belief that can result in unhelpful movement patterns and prevent us from engaging in the very things that help us recover. If you'd like to know more, you can visit the show notes page at www.bodylogic.physio/podcast or contact us via EBP Podcast on social media. Until next time, have a fantastic and fun fortnight, and remember to ask, is there more to pain than damage? Please note, what you heard on this episode of Empowered Beyond Pain is strictly for information purposes only and does not substitute personalised, high-value care from a licensed and trusted healthcare practitioner. We are all individuals and need to be assessed and managed as such. Theme music generously provided by Fervin and Cash.